If you are like most of the patients we treat at San Antonio Neuropathy Center, you might be watching this video with a healthy dose of skepticism. You've probably seen a number of medical professionals about your peripheral neuropathy pain, perhaps tried various prescription drugs, but despite everything you've tried, your pain still exists. Maybe, worst of all, you've been told by one or more doctors you'll just have to live with it, or that your pain's all in your head.
When a patient first walks through our doors, they're typically very skeptical, and I understand where they're coming from. They've usually been to a variety of doctors spanning from podiatrists to some of the most renowned neurologists who basically say the same thing. Your neuropathy is permanent and you need to learn to live with it. Then they're sent out the door with a bunch of medications only to realize that they haven't received the relief they had hoped for. And the problem with this approach is not only does the medication not help the nerves, but it carries a vast array of side effects. Now, what makes our approach different is that we focus on treating the underlying cause of neuropathy, whereas most medical facilities treat the symptoms with medication. And we have great results with this. And part of our success stems from the fact that we're very selective as who we choose to work with.
At San Antonio Neuropathy Center, we know peripheral neuropathy pain is real. We see it every day in the countless number of patients we treat. Many of those patients, some of whose stories you'll hear in a moment, will sound very much like your own. They too were skeptical, were frustrated, and thought maybe nothing could be done about their pain. However, what they discovered is that there is hope, and you can get your life back. But we know we have some convincing to do before you take our word for it. So let's begin with an actual patient story, one of several we'll share during this presentation. What you're about to view are the raw comments taken from our patients. Real stories from real people with real results.
I first found out I had neuropathy about 8 years ago, but at the time I didn't know what it was. I just knew that I had a lot of pain in my feet and they were burning, and it wasn't until about 3 years ago that I found out that what I had was more than likely neuropathy. I had to stop working out at the gym because my feet couldn't take it anymore because they were getting so bad. My experience at this clinic has been absolutely phenomenal. I had hope for the first time. I felt like before this I was headed towards wheelchair and/or amputation because of the pain was so bad. This place has been a godsend to me. My pain is almost gone completely. The doctors and the staff at the clinic have been beyond phenomenal. Everybody is very courteous and fun to work with. They make you feel comfortable, and they're very professional in what they do. Thank you so much to the doctors and the staff at the San Antonio Neuropathy Center. You've changed my life. You guys are awesome.
This is just one of hundreds of stories we could share. But let's back up for a moment and take a quick look at why and how your body is going through what it is with peripheral neuropathy.
Basically, the body's nervous system is made up of two parts: the central nervous system, which includes the brain and the spinal cord, and the peripheral nervous system, which are the connecting nerves running from the brain and spinal cord to the rest of the body, including your hands and feet. If you think of healthy nerve endings like this dandelion, the nerve endings pictured here at the end of the stalk are pretty full and complete, much like your nerve endings were before your symptoms began. However, as your condition gets worse, nerve endings can deteriorate, causing a host of annoying, painful, and sometimes debilitating symptoms. And if you're like many neuropathy patients, when your doctor initially diagnosed your condition, they may have told you that your nerve endings were dead or too far gone for treatment. However, we find that more often than not, that's just not the case. But more about that in a moment.
I felt like I was walking on sharp glass every time I stood up, and my back surgeon said that that was because of my diabetes, and it would just progressively get worse. And I'm like, oh Lord, if this gets worse, I don't know if I can handle it. I'm able to do a lot. In fact, I usually do swimming pool therapy 3 times a week, and what I'm doing basically is running back and forth in the water, trying to strengthen my body. And I'm not having the same painful existence by just putting my foot down and putting weight on it. No, I'm able to do quite a bit. In fact, the other seniors in the pool, they always tell me to slow down because I'm making them look too bad. And that tickles me. This treatment has helped me enjoy the things I always enjoyed, and I'm able to do them again and not be apprehensive about them.
As far as the causes of peripheral neuropathy, those can vary. However, research suggests that as many as 2/3 of all people suffering from diabetes will develop peripheral neuropathy. Neuropathy can also commonly develop as a result of using statin or cholesterol-lowering medications, blood pressure medications, and is a common side effect for people undergoing chemotherapy or radiation therapy.
The biggest misconception about neuropathy is the fact that it's classified as idiopathic, meaning of unknown origin, and that's simply not correct. We do know the causes of neuropathy. They're things like diabetes, side effects from medication, chemotherapy, and even environmental toxins. Now, what many people don't realize is that there are an enormous amount of toxins or chemicals in the foods that they're eating. Things like MSG, aspartame, which do a lot of damage to the peripheral nerves. In their personal care products, they have chemicals like methylparabens, and even in their mouth, their silver fillings have large amounts of mercury, which do an enormous amount of damage to the peripheral nerves and to the nervous system. Now, really what makes a diagnosis difficult in peripheral neuropathy is that rarely is there just one or even two underlying causes. Usually there are multiple causes leading to the peripheral neuropathy.
Additionally, neuropathy can result from spinal-related conditions like stenosis, herniated discs, and sciatica. And oftentimes the condition is misdiagnosed as plantar fasciitis, Morton's neuroma, and restless leg syndrome. As with many disorders, early detection and treatment of neuropathy is very important. So just what are the warning signs of peripheral neuropathy? Symptoms typically occur over the areas of the body that are covered by socks or gloves, such as your hands, feet, and legs, which is why the condition is often referred to as the stocking and glove disorder. Symptoms or warning signs of peripheral neuropathy can include numbness, tingling, or a pins and needles sensation, burning pain that can sometimes be so severe it feels like your feet are on fire, sharp or stabbing pain causing an electric shock-like sensation, deep or a dull, achy pain, swelling in the arms and legs, cramping or restless legs, extreme sensitivity to fabric touching your skin, even discomfort from bed sheets at night, which can often result in sleeplessness. You may also find that you're constantly dropping things or experience an inability to do things with your hands that were once easy. And besides being generally uncomfortable to downright painful, peripheral neuropathy symptoms can also lead to difficulty walking and an overall lack of balance and coordination, which can result in falls. Patients with peripheral neuropathy are 15 times more likely to be at risk of a serious fall. And sadly, falls are one of the leading causes of fatalities amongst the elderly. Now, if you're like most of our patients, you've probably experienced several of these symptoms. However, the good news is that you've turned to one of the nation's premier facilities for treating peripheral neuropathy, the San Antonio Neuropathy Center.
Widely featured throughout the area in print and online publications regarding topics related to peripheral neuropathy and other conditions, San Antonio Neuropathy Center doctors have been profiled on local network news programs, as well as on San Antonio area TV shows like Great Day SA and Daytime at 9. The doctors of the San Antonio Neuropathy Center are certified in neuromuscular disorders and neuropathy. Additionally, our doctors are certified in therapeutic lifestyle changes designed to aid and support the management of glucose levels for pre-diabetic and diabetic conditions. Additionally, the doctors are also certified detoxification specialists and leading experts in the science of environmental toxicity and its effect on health.
When a patient first walks into the therapy area, I think they're a little bit excited, maybe a little bit anxious, because they see all these foreign medical devices and people are buzzing around. But once they get past that, they realize that it's actually a very calm, caring environment where people are tailoring to them and really just helping them heal. Not only their extremity, their feet, but also helping them regain hope and realizing that they can regain their life again.
In addition, Dr. John Coppola and Dr. Valerie Monteiro Coppola recently co-authored the book Defeat Neuropathy Now, in Spite of Your Doctor, the critically acclaimed resource that takes an eye-opening look into why drugs and traditional therapies leave most neuropathy sufferers miserable, and what you can do to finally break the debilitating grip of neuropathy.
At the San Antonio Neuropathy Center, we utilize a gentle, proven approach to treating neuropathy without surgery, non-invasively, and completely drug-free. At the core of our care is a multidisciplinary approach that includes 5 critical keys for defeating peripheral neuropathy. Those include, number 1, a comprehensive neurological evaluation. This is primary to defeating neuropathy as it enables us to determine the type of nerves damaged and the extent of the damage. 2, reducing inflammation systemically or throughout the body. Depending upon the severity, we use detox methods and herbal formulations to reduce systemic inflammation. This is imperative to prevent the further spread of nerve damage. 3, increasing circulation and oxygenation to the nerves. This is accomplished with the use of specialized laser technology that increases circulation by 300 to 500%, dramatically increasing oxygen concentration in the tissues. This device also triggers the release of nitric oxide in the body. Research has shown that nitric oxide promotes repair of the damaged nerve cells.
A closer look illustrates how the use of laser therapy and infrared diodes can help heal the body. At the basic level, all cells in the body have a miniature power plant within, called the mitochondria. This is where our cell's energy is produced. The technical term for this energy is called adenosine triphosphate, or ATP for short. Patients with neuropathy have decreased blood flow and weaker mitochondria, which causes nerve cells to improperly transmit impulses throughout the body, most commonly in the extremities. Because the mitochondria are very sensitive to light, concentrated laser light therapy stimulates a rapid increase in ATP production in the mitochondria. With this intense increase in energy production, the light frequencies greatly improve blood flow as well as the production of oxygen, nitric oxide, enzymes, and other vital elements to help the body's nerves heal naturally on a cellular level. The result is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulates healing.
The 4th key is neurotrophic nutrition. This aspect incorporates the introduction of specific key nutrients, which have been shown by scientific research to assist in nerve repair and diminish painful symptoms.
To accomplish this, the doctors at San Antonio Neuropathy Center, along with leading chemists, have designed a proprietary neuropathy formulation called Nirvana. Based upon the most current research studies, Nirvana was developed to support and accelerate nerve regeneration. Naturally absorbed by the body, Nirvana helps to minimize nerve cell damage while improving communication and proper signaling of the nerves. Other important benefits of Nirvana, as shown in research, are a decrease in glucose levels, improved insulin sensitivity, and increased circulation, allowing for better nerve repair and regeneration.
And finally, number 5, restore nerve communication. When your peripheral nerves become damaged, your brain will create new pathways to get the information to the impaired nerve. Unfortunately, the information never properly reaches its destination. This is one of the largest contributors of balance problems, which can lead to falls. We restore the proper nervous system pathways by using quantum sensory techniques, creating what we refer to as a nervous system reboot, to increase balance and stability.
The 5 keys to defeating neuropathy are so important because the average medical clinic will only utilize 1 or 2 of these components. And what we found in our 20 years of experience is you simply can't repair or regenerate the nerve with just 1 or 2 of these components. Now, we certainly want to alleviate pain. That's foremost. But we also want to repair the problem so the patient never has to revisit this or suffer from neuropathy again. Putting together these 5 keys really sets the stage for nerve repair and even nerve regeneration. And all of this has been backed up by the latest research.
Our goal is to end your suffering for good. In fact, we have an over 90% patient treatment satisfaction rating. It's San Antonio's most complete neuropathy treatment program available, without surgery, non-invasively, a completely drug-free solution.
Additionally, recent studies have profiled the use of laser therapies in reducing patient pain ratings before and after initial treatment sessions. In one significant study, profiled at the North American Association of Laser Therapy's Pain Week, it was revealed that after just 4 weeks of treatment, the average pain rating described by patients went from an average level of 8.1 down to a level of 2.9, a decrease in pain of over 64% in just 4 weeks, utilizing the same treatment protocols found at the San Antonio Neuropathy Center. Likewise, further studies are revealing dramatically increased nerve regeneration in patients utilizing these same treatment protocols.
That's a little about us, our staff, and the science behind our treatment methodology. However, we know you might still be skeptical. Given what most peripheral neuropathy sufferers have experienced up to this point, we accept that. And so with that in mind, we hope as you watch a few final patient stories, you too will begin to feel that there is hope to overcome the frustration and break the grip of peripheral neuropathy pain and finally get your life back.
At its worst, I could barely walk. Beforehand, I would exercise regularly. I like to be outdoors, like to run, like to exercise. That stopped. I was homebound. I had to take leave of absence from work, and everyday actions essentially became non-possible. I'm back to a place now where I didn't think was possible. I had been told that my nerves may heal, but that I was not going to ever have 100% recovery. And I think that this treatment, more than any other, has gotten me towards my goals of getting better and running and exercising and feeling good and being pain-free. And that's where I wanted to be, and that's where I am now.
I started experiencing the neuropathy about a year before I retired from work, and I started by feeling the discomfort under my feet, and that discomfort escalated to sharper pain, ball lightning pain in my feet and up my legs, and it was so bad that it would wake me up. I just couldn't have a full night's sleep. I can do many things now. I can even play basketball and golf again. I mean, that is unreal. I mean, me playing basketball with a bunch of 14 and 15-year-olds is unbelievable. So I can attest to the success of what I came here for.
So now what? Maybe you still have a few questions like, is your condition even treatable? Could your condition get better on its own? Well, just know that the consensus of the professional healthcare community, including top neurologists, oncologists, surgeons, and others, all agree that peripheral neuropathy rarely, if ever, improves on its own. More often than not, the condition continues to worsen and can become completely debilitating. Finally, you may be asking, should I wait? Or perhaps, if I am a candidate for treatment, what does treatment cost? Lastly, will insurance cover any or all of my treatment? These are all valid questions. However, to answer these and any other questions you may have about treating your pain, there's only one way to find out. Give us a call today and reserve one of our new patient consultations. During that consult, we'll conduct comprehensive neurological testing to see if you are a candidate for treatment. From there, we can answer all of your questions based upon your unique condition. The sooner you make the call, the sooner we can help you resume your life.
The reason we come to work every day is because we get to witness transformations. And it's not only the physical transformations, which is what I think the patients value the most, where they're now playing golf or playing with their grandkids or taking a walk through the mall, but it's that emotional, that spiritual transformation. When the patients stop me in the hallway and give me a hug, and you see that smile and the laughter that starts to come back into their life, that's why we come to work every day. It's because we witness these miracles every day. That's the most rewarding thing, and that's why we do what we do.
Thank you for watching. We look forward to hearing from you soon.